I have to say that it's going to be a tough act to follow from Ken's. If anyone was in Ken's presentation, I found it to be really fascinating. And on the topic of big data and genomics being one of them, personally, I think if a meatball is made from meat cells, it's meat. I'm not sure the vegetarians would want that either way, but very interesting topics. Today we have the topic of big data and how that's used with value-based care. And as we know, they grew up in different paths, if you will. Big data is very much grown from consumerism and the internet and the fact that it's in everyday life. And value-based care is a sort of a mandate from the government to get the cost down and the outcomes and quality up. So now they're talking about those as one, and today we're going to talk about big data for value-based care. And we have a distinguished panel here. I'm going to have them introduce themselves, and I'll start with Clare. And if you, in your introduction, kind of mention a little bit about some of the areas where you have found big data or finding big data useful.
Okay, thank you. Good afternoon, everybody. My name is Clare Benson, and I am the Director of Clinical Informatics at Torrance Memorial Medical Center in Torrance, California. I have been in that position for a year this month, so I'm not going to come to you saying that I am the total expert on what Torrance has done, but prior to that, I worked for some EHR vendors, and I did spend 29 years as a nurse in a hospital. So I have nice clinical and IT experience, master's degree prepared. IT has been my passion for the last 20 years, and I really am excited to be here. We have implemented pockets of big data. I think when you talk about ACO, we implemented that in 2012. There's a lot of history behind what they have done. We're doing HIE. We're a partner with MemorialCare, and we'll talk more about that later. But anyway, very excited to be here, and thank you. You have your own.
Hi, Scott. All right, there we go. Hi, Scott Raymond. I'm the Executive Director of Strategic Innovation and Technology for MemorialCare Health System. I also run one of the hospital ITs in Fountain Valley, so Orange Coast Memorial. I too have a kind of varied background. I started in aerospace many years ago, transitioned to nursing. I know that's a normal path, right, everybody? And then kind of got drug into kicking and screaming into IT to do our Epic implementation. So implemented Epic at 6 hospitals, got loaned out to Brady Children's to do their physician adoption. And from a data perspective, we've been on kind of a big data warehouse journey since 2010. We built a infrastructure in our warehouse, is live today. We kind of have a multi-tenant warehouse with SAP, HANA, we have Epic's Caboodle, doing Hadoop now. We're a partner with Health Catalyst. We have them deployed. So, we think about our warehouses, like going to the mall, we have multiple buildings and they all kind of talk to each other. And we're kind of, I see data, and we can talk about it more. We have a lot of shared things with Torrance and Cedars-Sinai. But I kind of see data, the whole purpose of it is to drive clinical care and drive the business. So we're all getting a lot of pressure to do better care, better quality care for a lot cheaper price. And the only way you can do that is with data. And if you can analyze that data and use that data in a meaningful way, I think that's the goal of it. And we're kind of in the beginning of it. So if you think about the EMRs, we've all done that now, right? It's old news. But big data is probably where the EMRs were 10 years ago. So we're super good at collecting all this data. We have 10 plus years of Epic data. So we can gather it really well. So we have big buckets, we can gather it. We're starting to learn how to analyze it pretty well, but we're not using it in a meaningful way perfectly. So that's kind of our goal.
Thanks, Scott.
You guys hear me? My name is Alan Young. I am the current regional director for Sagacious Consultants, covering the Southwest United States. Sagacious Consultants also part of Accenture. My background, I attended undergraduate here at UCLA and then went over to USC to complete a medical school degree as well as a business school degree. I then went on to an orthopedic surgery residency training program, then moved over to Kaiser Permanente to work in the physician group there. And then I started doing consulting with Deloitte before rejoining USC as the director for operations, strategy, and special projects. There is involved with a lot of our quality efforts, optimization of Cerner, and also physician adoption and engagement around all the new healthcare reform initiatives. I joined Sagacious and Accenture last year and still continue to practice medicine here in Los Angeles. And I think for us, big data comes out a lot of the work we do with specific EMR vendors. As you can imagine from a previous speaker, the EMR serves as a hub for all the information and where most providers would like to go to either access information or input information. So for us, it's very exciting to be able to take that information and produce something meaningful that provides either clinical decision support tools at the point of service, using it to analyze revenue cycle optimization efforts to improve collections and billing and charge capture, or even to think about population health in the sense of taking all the information, not just from your organization, but for other organizations that are sharing information and really be able to determine the best clinical care for your patients.
Hello, I'm Jim Brady, also am a USC grad, and the title that I'm most proud of is I'm past president of the FHIMSS Southern California chapter. So let's give it up for our chapter here. They still let me show up from time to time. So I'm currently the CIO at Kaiser Permanente in Orange County, the Anaheim and Irvine medical centers, and then there's about 23 clinics. Got a couple members of my team over there. I'm also doing double duty in the island of Maui, so that's a tough gig. So I'm having to go back and forth over there because Kaiser is kind of starting a new venture where we're operating 3 of the Maui, Hawaii hospitals. So we're going to be cutting them over to all of our IT systems July 1st. So tough deal there, but somebody had to do it. So. So when I think of Kaiser Permanente, it's obviously a really large organization. We operate at the medical center level. We operate regionally in Southern California. As we just heard, Alan was a former Southern California Permanente Medical Group physician. So I think of just, and then we operate nationally. So I think we'll get into it as we talk about big data and what Kaiser's doing. So we do. It is a national platform that we set up, but I just think of, just all the data. Just there's so much data in these siloed systems. Claims, our EHR, procurement, et cetera. So there's so much. Even the patient portal. I think I heard a stat recently that we had 90 billion records as part of our patient portal. So it's a lot of data that we aren't really taking advantage of. And then really just how do we remove the silos? How do we help the business understand that, hey, this is something that's going to drive value, improve quality, drive down costs, et cetera. So lots of potential. We're doing a lot of things kind of just starting, but we started our big data journey about 5 years ago. So we're still kind of, we're out of the NICU and we're probably getting into, grade school with it. So anyway, thank you.
Thanks, guys. So what I hear is that there are much data that's resident in our EHRs, and as we share with others, there's even more. And so for many, that's big data because we came from paper to that. And the question though is, so that took a while to get those EHRs. It took a lot of money to get those EHRs. What's the driver and who's the sponsors to let you spend more money to build these things? Because one might say, it's like, well, you've got the EHR, what do you need anything more for? You've got the data, why can't you just give me what I need? So how has that sort of decisions to go into a electronic warehouse and beyond that, lakes and big data from whether it's genomics or, just walking around monitors that are Internet of Things type of orientation. What were the drivers and where were the sponsors on that? Anyone want to speak to that?
I can take it for us. So the drivers is pretty simple. It's just economic, right? So I would challenge anybody to tell me that they've got an ROI out of their EMR. We've spent upwards of $100 million on Epic, and yes, it's a great system. You have to go to it, but it's not making care more efficient. A lot of people would argue it's making care less efficient because there's more input, and you hear back from doctors that they've been turned into clerks, right? So the data that is housed in the EMR, the driver to analyze that big data is to get the value out of the EMR. So like I said before, with the decrease in reimbursements, you have to do that care more efficiently, and guess what? You have to do that care better. So I think ideally we all want to move to a predictive analytic model set where I can look at that data and I know that I can treat a certain subset of patients in a way that is better care and more efficient care, and that way I can get them through the hospital and healthy and keep them out of the hospital. Without data, without analyzing that data, there's no way to do that. It's, like you said, it's just housed in buckets. So that's kind of our driver. The sponsors, we call the President's Group, so it's the CIOs, the CEOs, the CFOs across the enterprise. They get together. We have to present every project. It has to have an ROI, and it has to either be improve patient care, regulatory, or have an ROI. So that's kind of our basis of what we look at it. The data warehouse wasn't cheap either, so all the analytics and all that cost money, and the team cost money. So for us, it's the largest, fastest growing team in IT. So they need to show the value. So the only way they can do that is to really analyze that data, get the data at the fingertips of the clinician. So just-in-time data, right? It's not enough to look at stuff in arrears and reports and then try to act on it later. You want to act at it at the time of care. So that's where we're all driving to.
Great, thank you. So it sounds like you've got your own team that's specific to that, and that's an interesting organizational sort of note. I'm not sure how many have a special team, but that's worked best for me as well. It is a very important function. Others that, who's...
Yeah, I can jump in here. So we all know in IT that IT doesn't drive the business. We don't tell our organization what to do. We partner with our business partners, our clinicians, and really try to understand where is the organization wanting to go? What is the business needing? And then we work together to provide awesome solutions, right? But in the case of, I think, big data, and I'm not sure if there's a book, Big Data for Dummies, or how to start a big data shop or something. But so obviously there's a fair amount of resources with Kaiser Permanente. But interestingly, I wasn't here at the birthing of the big data, era. I've been at Kaiser Permanente for about 3.5 years, almost 4 years. So about 5 years ago, there was definitely business alignment, value understood, but really the IT organization went ahead and said, this has so much potential, so let's go ahead and so they got core funding, set it up, so Hadoop, and so I think there's about 25 different products on the analytics side. So basically we just kind of started the big data platform. We came up with some quick wins. I think there were 4 the first year, I think 4 the second year. And it was really just going out to the business, sharing the use cases, and now if you think about it, if you look at our organization, I don't know if there's any department that wouldn't benefit from the analytics that a big data platform can actually provide. So there's just so much value. It's crazy. It's incredible. But really, it started out with just Kevin Costner, Field of Dreams. If you build it, they will come. So normally that doesn't necessarily work all the time. But so we did build the platform. We started adding to it. in organizations that maybe they can't bring it internally, there's Azure, there's AWS, but there's things that you can do. But I think it's just really coming up with something and bringing some use cases. And once you engage the business, then they say, hey, what about this? So it's really, I think it really helped us a little bit to get started. But it did kind of come from the IT group, kind of making the initial investment.
If I could just add, we're a community hospital, so we're not part of a big healthcare system, but we still have a very strategic, visionary operations committee that consists of our VP, or VPs, senior VPs, and I think that when we look, one of our drivers is, of course, quality, and looking at the triple aim. How can we improve that patient experience, give them better quality at a lower cost? So everything we do, I think our organization is a magnet organization, and we are very concerned about how are we going to deliver the best quality and get the best outcomes for our patients. And I think that's where we are going down this road. We're still having strategic meetings. We haven't got there yet, but just as others have said, the EHR took a long time to mature and get where it is, and so we'll have that same journey, I'm sure, with big data.
And I'll put on a different hat since we have the small health system, large health system, and gigantic health system perspective covered. We tend to look at it as a healthcare ecosystem. And what we try to do is we work with our partners, including Kaiser and MemorialCare, to really provide them with point of view and perspective of where the trend is going, where the puck is going to, rather than trying to skate and catch the puck to where it's at now. Some examples of disruption you heard today. In healthcare, many people would agree that we're very risk averse. We don't want to go out and try to experiment and do new things because the ultimate, beneficiary of that disruption is a patient. So we can't really take too many risks when it comes to innovative thinking and experimentation. But with our firm, we try to push the ecosystem and grow the ecosystem in the direction that we feel is best for the health systems and the patients. So things that around big data, we try to understand, what is everyone doing? What thought leadership needs to be done out there so that leadership at different organizations will have a reference point to take a business case, to take an example to take to their leadership and say, this is what other organizations are thinking about, this is what other health systems have done, and this is something that we feel strongly we need to pursue as well.
Thank you. So, tying in the value-based care, which is about decreasing our costs and increasing the outcomes and all, we heard there's a lot of very clear examples about how one would use the EHR data. There's lots of other data out there. That's why they call it big data. Otherwise, they would call it EHR data, right? So there's big data outside of the EHR. There's the data lakes and Hadoop and all these other new tools. What are some of the use cases and high-level technologies that you've used to taking a look at big data outside of the EHR, or supplementing the EHR data with data from other sources? Could anyone speak to?
I'll just start off with, a simple use case. It's not simple, but it's one that comes readily to mind, is the use of the patient portal. Because there are many types of data that big data encompasses. It's not just EHR, it's not just clinical data, it's financial data, it can be device data, it can be all of these various types, and even looking at zip codes or locations of where folks live. So if I define a subset, let's say a diabetic, frail elderly that's in a lower socioeconomic zip code, then maybe I can target some information, some education just to that group and give it to them through a portal. So that's just one example that I can come up with.
Any others where I've heard Hadoop mentioned a couple times, and how are you actually using that new technology, and for what use case does that find itself useful for? Does anyone?
Yeah. So I know that in our experience at Kaiser Permanente, the EHR has a lot of valuable data, but we're looking at other kinds of data, and so maybe a good example might be And I think maybe this might qualify a little bit for EHR data, but we have a program right now that's, we're using our big data platform to look for any signs of influenza-like illness, so when, maybe in an encounter, and then also maybe looking at some of our ancillary systems like lab, any tests for influenza. And then what we're working with the county of Department of Public Health in Los Angeles, and I think we published an article on it pretty recently, where we can actually use the Kaiser Permanente Southern California membership, which is about 4.3 million folks, and then look and see who's actually presenting with flu-like symptoms. So it's really called a flu surveillance program. And then we work in concert with them, and they can see where we actually generated heat maps, so we can see, which areas are having potential lots of cases of folks, reporting in for or being detected with flu, and then we can go ahead and do proactive things. Like one of the things we can do at Kaiser Permanente is if we have an employer group that might be in that area, we can go on a vaccination. We can take the initiative to say, hey, let's vaccinate all your members or all the members, the Kaiser Permanente members at your organization. So that's kind of one area. We also do vaccination targeting in those areas. So we'll actually do a special effort with the county to say, hey, let's really try to push out and get the individuals vaccinated. So it's actually, it's a really great way to work on what would be population health. But it's actually using the big data platform that we're taking some of our information from our EHR and ingesting it into, along with some of our encounter data. So that's kind of one example.
That's a great example. That's in effect using public health data that's available and integrating it for sort of targeting. So that's a interesting use case. Any others or question?
So something that's been brought up in a previous talk, I'll touch upon it lightly, but it is this concept of the technology behind Bitcoin. So it's called blockchain. And many people are nodding their head, and they've probably heard about it. For those that haven't, I'll try to simplify it as much as I can. It's basically a connection point that replaces what used to be a wheel and spoke. So you have a centralized wheel, and you have many spokes. To get information, you had to go into the central area and get either validation or approval, and then that would go back to the edge of the wheel or the spoke. Blockchain kind of replaces that with a donut. So you imagine a donut with the hole centered out. And that means that everyone is contiguously connected, and you create a connection between your transactions. So when you talk about a verification for a patient prior to treatment, you talk about credentialing a physician to make sure that they haven't committed any atrocities in their past. These things are all connected. So everyone who accesses that data is in a chain, so to speak. So company is really, again, trying to push the ecosystem forward to say this is, has a great potential in the market. If you look at the amount of, venture capital investment last year alone, it exceeded $1 billion in blockchain companies. 3 years ago, it was about 300 million. So just by, where are people putting their money to think about the future, that is one area. And they expect in 2017 that healthcare will be the largest area where new blockchain-related technologies will emerge. Prior to that, it had been mostly in finance and gaming and government defense. So those were the areas where it's already been a very prominent player. So thinking about using technology to expedite processes in the hospital using data that's traditionally not in the EHR is something that I think our company is focused highly on to push the envelope forward so that other health systems can start to adopt it, and hopefully at a lower cost rather than the people that are first using that.
That blockchain is a fascinating area. If anyone hasn't looked at it, it is fascinating, and it brings up a lot of big data type issues, although it really has an authorization capability that is reportedly to be even more secure than others we have. But there's lots of issues around it, but I do believe it's interesting, and it's sort of a technology that has grown up in a big data world. So that's interesting. Any other thoughts on?
Yeah, I think for us, since we're involved in multiple ACOs, and we have a collaboration with Cedars-Sinai and Torrance Memorial and 5 other hospitals. So we I think the idea of collecting your own data, collecting patient portal data is important, but if you're really trying to manage a population and have lives at risk, I think we're up to 250,000 at-risk lives that we manage. You want to get that data from everywhere, but you want to get that data from your partners as well. So you want to learn from what they've gathered, and if we put our data together and analyze that, it becomes more powerful if you think about a whole community. So we've been working on that, and we're in the infancy of it, so we not quite sure how to connect. So blockchain is maybe a potential to help with that, and it might help with the HIEs as well. But it's a goal. I just don't think we're quite there yet, but I think that's the point of the ACOs.
So yeah, I think it's actually very interesting that they call big data because it really is a bunch of little data, and that's just out there that is now for the first time accessible. Before it was sort of hidden, but now it's accessible, so the aggregation of it all is big data. But all of these small data points, whether it's from your Fitbit or monitors, telemedicine, et cetera, is opening up a whole new set of opportunities to look at how we can improve care and lower cost. Are there questions? I want to pause a bit and see if there are any questions for our panelists or topics that you might want us to touch on.
Do you see the traditional large-scale EMR companies ever moving into big data, or do you think they're just going to be complacent to be the collection point, and then it'll be other new ventures that are going to primarily drive the big data?
Well, I can tell you from Epic's standpoint, they're hiring data scientists, so I mean that tells you what they're up to. They would rather develop something and give that to their customers than to partner with a third party. I think they're behind, but just like in the EMR, I think they'll do it well. It'll take a while, but oh yeah, they're all in that space for sure, because they know they have the same thing. If you think about Epic, they have, what do they have, 80, north of 100 million lives in Epic. So if they were able to pull all their data together and start doing analytics on that, how powerful that would be, because it's not just one location, it could be nationwide, and you could start to segment those populations and look at disease processes that might be only on the East Coast or disease process that only be in the Midwest, and how to manage those more efficiently. So if they're not, if the other big EMRs aren't doing it, I would be very surprised.
Yeah,
Right. We hear you back there. There are, in fact, I think it's true, and I'm not sure exactly where it's going to end up, quite frankly. But every major, EHR vendor, has a population health, big data sort of program, whether it's more advanced than others or less. But they are trying. Whether or not that's actually going to be a solution for the industry or not is sort of an open question in my mind. But
I was just going to add, I worked for Cerner for 12 years before I came to Torrance Memorial, and I can remember one of our founders saying at least 2 years ago, maybe 3, that the EHR market was pretty saturated, and where they wanted the company to go was actually into these fields of looking at how do we use this data. We've got, what do we do with predictive algorithms? How do we grab all of the different things in population health that can make a difference? Yeah. So Cerner was very much involved in that.
Yeah, and I think it's important to differentiate the EHR, the EMR, and then the EHR company. I was at FHIMSS 17 a month ago. I heard an interesting talk at the CHIME session that they had on, I think it was Monday. But I can't remember his last name, but I'll just call him Dr. Joel. But he quoted Dr. Eric Topol that EHRs will be either extinct or in 10 years or something like that. It was a pretty radical comment. But then he really went on to just share how the total revenue that EHR companies to date, I think it's 10 billion or something, but the ecosystem outside of the EHRs, which is big data, all Internet of Things, all these things, it's 100 billion, and it's only bigger. So the first slide he showed was the EHR in a kind of a circle. And then the Internet of Things and all that was very small, but due to the size of the growth of these other outside of the EMR system of record, so to speak, it just dwarfed, and then a slide further on in this presentation showed the EHR was just microscopic compared to the rest of what's going to be going on in health IT. So I think it's just, if a company is able to divest and get, to be able to have open source and really have an open architecture, then it's possible. So I can't really predict that, but definitely there's going to be a lot of opportunities for revenue and growth outside of the traditional system of record EHR.
Thank you. I think what's ringing in my mind is some of the previous speakers, and I sort of have this visualization of the EHR being the Route 66 highway that's connecting the east and the west or what have you, and where the value is on the on and off ramps of that highway, where you build the cities and you have innovation, because the folks building the road many of them are so tired that they don't even have the energy to do that. Plus, you do need, as we talked earlier, the new thought process. So I visualize it as, that hard work is done, or is about, and then we're redoing it. To me, it's patching the road. But at the end of the day, where are those on and off ramps that give us the value, whether it's big data, whether it's the population health venue or what have you? And I'm not quite sure. We look at where other people's feelings are, whether these things should be complementing each other as opposed to one fits all. But does anyone have comments on the one shoe fits all, or is there a whole closet of shoes?
So I like the analogy of the freeway going coast to coast, and two words pop into my mind: interoperability and consolidation in healthcare. So interoperability is that word that will allow vendors or health systems to share data between vendors seamlessly, and that's a vision that I think CMS has. Whether or not the different vendor companies feel that way is the future, that it may lead to obsolescence, like James talked about, because if their data is then shared in the cloud or everyone has access, then the entry point for the data is irrelevant. But what's happening in healthcare is there's a lot of consolidation. So we can talk about major purchases of health systems by health systems, and what is one of the first key expenses they think about doing? They think about consolidating to a single EMR system. We heard earlier about the working in a system when there's 6 to 8 different versions. It's frustrating. It can be technically draining. It could be frustrating for your patients and your providers who have to log in and log out, and their record or their note in one hospital doesn't transcribe to the other hospital. You see a patient from Northern California and Southern California, and you don't have their record. It can be very devastating for a health system's reputation and overall patient satisfaction. So there's kind of a battle between becoming uniformly shared data versus having systems consolidate and protect their turf, because I think that's, in the end, there's a business imperative to maintain some, independence or uniqueness in the marketplace.
Thank you. Are there any other questions out here? Sure.
Question for Kaiser, Permanente, James, and is it Scott from Memorial? Yeah. So Cedars-Sinai, about a year and a half ago, has actually created a technology venture group, had a contest, so they're actually incubating some startups within their structure to kind of be early to market, right? I'm curious if your institutions are doing something similar. Thank you.
Yeah, so interesting you bring that up. So Cedars-Sinai and MemorialCare have a partnership in innovation called Summation Health Ventures. So it's an evergreen fund that we look at healthcare IT companies specifically and invest in them. We vet them both through MemorialCare and through Cedars-Sinai. Part of that work, we're building an innovation lab at MemorialCare to be able to do proof of concepts, to vet those companies out and not have to intrude on the hospital or patient care. So a good way to, kind of like a wet lab, you could look at these things, you'd have clinicians come over and pound on it, and then you could see the value both from an investment side and from, is it something that we'd want to implement in the hospital itself. Cedar kind of takes it to another level as well. They have Techstars, which I think what you were kind of alluding to, where they have an incubator and they bring in these really early stage companies to kind of vet out their technology. We're not looking at stuff that early. Kind of the B round, for those that like to invest in stuff will know what that means. So our whole purpose for that is we want to look at companies that add value to healthcare itself. If it benefits us, that's great, or if the company makes money, that's great, but that's not the kind of the driver behind it. So innovation, I think to the earlier talk, without innovation, we're just stagnant and we're not going to get any better. And we have to take those risks. But it's hard to do. Not everybody does it. But imagine if you had these labs across the country and you could partner with a partner that has access to those labs. You could knit those labs together and you could test out in multiple healthcare systems with multiple EMRs. You could start to stitch together a way to do what we want to do with that data too. So we're looking at all that stuff, and it's fun. So that's part of my role. That's why I stayed in healthcare, to do that. So
Great. Great question. I think in general, the topic of big data and the topic of innovation and various apps and all of these various programs for incubation and all that, it just goes to the point that where you have a lot of data that's accessible, there's a lot of possibilities that you can do with it. And we haven't, we're just beginning to explore those possibilities. We know the EHR data, so we automatically gravitate there first. But you bring in these other minds that haven't been in healthcare so long, and you find some very interesting things. So I do think there's a blend of the two. But what really makes that available is the fact that there's a lot of data around. And if we can use it in different ways, we can really shape the value curve and either cut costs because you are able to predict behavioral aspects of a patient or a population, or increase sort of the value outcomes because their behavior and you could try to stop it. So I think there's a lot of possibilities there. Great question. Are there any other? Anyone else want to comment on that, or do we have any other questions?
Just to kind of complete the circle here. So if you can Bing or Google KP Ventures, and that's a LLC. I think it has a venture capitalist, kind of an offshoot that's, I believe, under the Kaiser Permanente Federation umbrella. So I think there's about 25 companies that have been spun off. There's 20-something that are kind of incubating. I know it's not related to big data, but there's a lot of really interesting stuff that I think they're doing. One of them is a pill that you can swallow, and it'll actually, where we'll know whether or not you have taken your medication or not, and it's ingestible. So it's an actual computer chip, and I guess it dissolves. So there's lots of interesting things, but I think this is and this is true for our big data group, because I did check in with them before I showed up here today. Hey, what are you guys doing? Because it's a big organization. And they're like, it's all about the data lake. We want everything. And it isn't, and really the understanding is we need all the data inside the organization to be put into that big data platform or whatever it would be, so we can actually start thinking out of the box. And this would be every department, every medical center, every clinic. We need to get that message out to the business folks saying, hey, if we're able to combine these data sets, what could you do differently? So I think it ties with just the culture. Even though we have the KP Ventures at Kaiser Permanente, really innovation is everybody's job. And right down from the management assistant, receptionist, all the way up to the chief doctor, what have you. And so it's a great opportunity to think, how can the workflow at my office or in my building change, and then we can bubble those ideas up. So it's really the notion of innovation is kind of it's really everybody's kind of role to do that. And so we get a lot of great ideas. We have a lot of, I think we have like 20 different internal innovation groups within the organization. So there's actually, it's something we have to do from our earlier talk. As we heard, we need to be kind of a little bit more disruptive. But big data does give us that opportunity because, if we can get that data curated, we can tag it and classify it, there's wonderful opportunities that we can do to change outcomes, to improve quality, to spend less money, and it starts with just the individual staff person.
Yeah, thank you. I think what Jim's saying is Kaiser can grow meatballs.
I'm going to go ahead and bring that up, see if they're interested in that. That might be on the priority list. That might be down at the bottom there a little bit.
Well, City of Hope might, because they're really in the genomics end of things. But yeah, it comes at all forms. Yes.
So I'll try to be brief. Couple of questions. One is, you guys are talking more from an enterprise perspective, and I wanted to understand your ambitions as it relates to synergizing the acute and ambulatory settings in terms of big data. One of the biggest challenges is really getting information back from some of the medical practices and smaller organizations that are servicing into your ecosystems. So I suppose that's the first question. The other question is I think we've talked a little bit about Epic and Cerner, again, the large enterprise software platforms. However, I think one of the challenges with interoperability and big data in general is harmonizing that information in two capacities. One is it relates to being vendor agnostic. And of course, as you guys know very well, most of the large interoperability platforms are either owned and operated by EHR vendors like Allscripts or NextGen, or they are in their own individual silos and developing proprietary APIs or channels back into their data warehouses. So I suppose that'd be sort of the second question is how do you mitigate risk around that? And then the last piece is quality and actionable information. I think the biggest long-term challenge with big data in healthcare is not so much aggregating it, parsing it, but rather making it actionable for a clinician in a way that is conducive to the way they provide care and also conducive to the patient in terms of how they understand that information and, of course, the entire scope of all that information. Thank you.
That was one question, yeah?
I'll try to take part two of that three-part question. I think one of the solutions that we as a company are firmly behind is the cloud as a source of moving businesses away from technology and space-dependent models to a shared virtual space. Obviously, there's a lot of hesitation based on security concerns, but some of the technology we just mentioned, such as blockchain and others, can hopefully mitigate those risks. So a lot of the clients we work with are really looking to utilize this technology, taking lessons learned from other industries that are already utilizing that option to store data and share data, and that will hopefully circumvent any vendor or technology constraints you might have. The other area is around using smaller systems and getting them integrated. I think one thing that has come about through one of the vendors is using a pared down version of the system or using a remote access version. For example, Epic has their Connect, and they have other versions of the system called Kit and Caboodle. And these are things that can be deployed to health systems that don't have the means to invest as much capital, but still want to move into an integrated system to allow for data sharing. So I took two of those. I don't know if I'll leave the third one for someone else.
Well, from MemorialCare's perspective, we used to be a hospital system. So we had 5 or 6 hospitals, and that's where the focus of the business is. Now we're a system that just happens to have hospitals in it. In fact, most of the focus is on the ambulatory space, just what you mentioned. So we went from 6 facilities to 250 facilities, and most of those are in the ambulatory space. Kind of our initiative is to where possible, put Epic in the ambulatory space. Where it's not possible, try to integrate the data. We're not there yet. We have an interface engine that we're managing HL7, and we're moving into Fire now. There's some other things you can use, Taffy and some other innovative ways to kind of connect. But until we have true interoperability, when all the ones and zeros line up, it's still going to be a struggle. So in the interim, we're trying to just put Epic in all those places as much as possible. So we have kind of a mixed model. We own an IPA, we own a foundation that has employed physicians. Those are all on Epic. We're moving our IPA folks onto Epic from NextGen. And then we also have affiliates, which are private practice physicians that we host Epic for. So we can gather all that data, and they benefit from the data and the analytics. And we have a lot of decision support mechanisms that flow out to all those folks. We're getting faster at it, and like I said in my earlier comments, you want that data at the point of care. So the physician who's working with a patient, whether it's in the ER or clinic or their office, to be able to access data to give them some decision support to make a better decision on the care of that patient. It's going to take a while. You're looking at what I think the genesis of your question is, to how do we get to where we can all communicate seamlessly and everybody, no matter where they touch the system, gets the same care. I think we're all moving that direction, but it's going to take some time, I think.
And I maybe want to be respectful of everyone's time. I would close on your last question as it relates to making it actionable. Okay, making it actionable is not the IT, it's not the data, it's not the technologies. They are great enablers, but someone's got to be looking at it until, maybe 20, 50 years they'll have the robots doing it. I know that there's a lot of artificial intelligence out there, but at the moment, if you want to really take action and you want to drive value-based care, big data and all these tools enable us to do value-based care better. But it does take people with compassion and professionalism to make the difference. So just don't want to lose sight of this. This is way bigger than IT or big data.
I think when we talk about technology, you can have the best technology in the world, and I'm sure you're all well aware of that, but without people and process along with that technology, nothing happens. It doesn't get adopted, or it just sits there and you have all this rich data and nobody's using it. I think the example I gave of the diabetic patient and taking that group and looking at multiple cofactors in that and pushing that out, that was actionable. I'm actually taking that data, identifying that group, normalizing that data, and then pushing it out through a patient portal so that there's a benefit to that group. So I think there are a lot of ways we can do that and we can use the data, but it always is going to take that people and process and technology together.
So, I would just, short answer would be it depends. And we're not there yet, okay? 20 years ago, 10 years ago even, one would think that, oh boy, I'm going to have the lab system and the ambulatory system and my ICU in one system. I would think, wow, that's great, because we didn't have products like that. Now we're talking about, oh, well, we've got the EHR. You mean we're going to have big data and data lakes and all this artificial intelligence that's in one product? Maybe. But certainly it seems like the EHR vendors would like us to be there. The question is timing. The question is need. And what is the business need now? And how do we drive value now? I think will drive the innovation. But I don't know. If anyone wants to project whether the EHRs are going to do it all or not, be my guest. I wouldn't bet on either way now.
I know the future, no. But if we just
Tim
look,
knows it, yeah.
just to add to what Paul was saying, I think it's
In
interesting
addition
to look at
meatballs, right.
to look at what are the other leading industries that are driving where we need to go in healthcare. the retail, finance, et cetera. What are they doing? How are they doing it? Where are they going? Because that's where we need to be at, if not in front of them. But if you take Google, Amazon, Uber, it's about open source, open architecture. It isn't really. I'm not aware that there's a single, even though they have their own platform, but really it's open APIs for interoperability and integration. And then, so I think that's where you really get the exponential growth. Big data requires a certain kind of skill set, data scientists, et cetera. It's a new way of thinking. It's not like the old, where you order a server and it takes, 12 months or 18 months. I won't say the organization that happens or used to happen in. But it's just a new way of thinking, and we can just look to some of our, other partners out there that are in other industries, and they're actually kind of showing us how to do it. So I think that's one of the ways I think we can get to where we need to get to in the big data world.
Well, thank you very much, and I hope this was valuable to you. And I enjoyed the conversation, and thank you and our panelists. Thanks for joining us, and enjoy the rest of the show. I think we are the rest, other than a closing mark and a break and a closing mark, and introduce.
Let's give these guys a good,
guys.
big round of applause here, Paul and team. Thank you.